75 free NCLEX questions / NCLEX practice questions and tests for 2026. Question 1. The nurse is taking the health history of a patient being treated for emphysema and chronic bronchitis. After being told the patient has been smoking cigarettes for 30 years, the nurse expects to note which assessment finding: increase in forced vital capacity, FVC, a narrowed chest cavity, clubbed fingers, and increased risk of cardiac failure. Clubbed fingers are a sign of a long-term or chronic decrease in oxygen levels. Question 2. The nurse is taking the health history of a 70-year-old patient being treated for a duodenal ulcer. After being told the patient is complaining of epigastric pain, the nurse expects to note which assessment finding: melena, nausea, hernia, hyperthermia. Melena is the finding that there are traces of blood in the stool which presents as black, tarry feces. This is a common manifestation of duodenal ulcers. Question 3. A nurse is providing discharge teaching for a patient with severe gastroesophageal reflux disease. Which of these statements by the patient indicates a need for more teaching? I'm going to limit my meals to 2 to 3 per day to reduce acid secretion. I'm going to make sure to remain upright after meals and elevate my head when I sleep. I won't be drinking tea or coffee or eating chocolate anymore. I'm going to start trying to lose some weight. Large meals increase the volume and pressure in the stomach and delay gastric emptying. It's recommended instead to eat 4 to 6 small meals a day. Question 4. The nurse in the emergency room is treating a patient suspected to have a peptic ulcer. On assessing lab results, the nurse finds that the patient's blood pressure is 95/60, pulse is 110 beats per minute, and the patient reports epigastric pain. What is the priority intervention? Start a large bore 4 in the patient's arm. Ask the patient for a stool sample. Prepare to insert an ing tube. Administer intramuscular morphine sulfate as ordered. The nurse should suspect that the patient is hemorrhaging and will need fluid replacement therapy, which requires a large bore 4. Question 5. A female patient with atrial fibrillation has the following lab results: hemoglobin of 11 g/dl, a platelet count of 150,000, an INR of 2.5, and potassium of 2.7 milliequivalent/L. Which result is critical and should be reported to the physician immediately? Hemoglobin 11 g/dl, platelet of 150,000, INR of 2.5, potassium of 2.7 milliequivalent/L. A potassium imbalance for a patient with a history of dysrhythmia can be life-threatening and can lead to cardiac distress. Question 6. While receiving normal saline infusions to treat a GI bleed, the nurse notes that the patient's lower legs have become edematous and auscultates crackles in the lungs. What should the nurse do first? Stop the saline infusion immediately. Notify physician. Elevate the patient's legs. Continue the infusion, since these are normal findings. The patient has a fluid volume overload as a result of overly rapid fluid replacement. The nurse should stop the infusion and notify the physician. Question 7. The nurse is working in a support group for clients with HIV. Which point is most important for the nurse to stress? They must inform household members of their condition. They must take their medications exactly as prescribed. They must abstain from substance use. They must avoid large crowds. Antiretrovirals must be taken exactly as prescribed to prevent drug-resistant strains. Even missed doses can reduce effectiveness. Question 8. A nurse finds a 30-year-old woman experiencing anaphylaxis from a bee sting. Emergency personnel have been called. The nurse notes the woman is breathing but short of breath. Which of the following interventions should the nurse do first? Initiate cardiopulmonary resuscitation. Check for a pulse. Ask the woman if she carries an emergency medical kit. Stay with the woman until help comes. Many patients with a known history of anaphylaxis carry EpiPens. This is the fastest way to stop a hypersensitivity reaction. Question 9. A man is prescribed lithium to treat bipolar disorder. The nurse is most concerned about lithium toxicity when he notices which of these assessment findings. The patient states he had a manic episode a week ago. The patient states he has been having diarrhea every day. The patient has a rashy pruritus on his arms and legs. The patient presents as severely depressed. Persistent diarrhea can lead to dehydration, which can increase the risk of lithium toxicity. Question 10. A 65-year-old man is prescribed Flomax, tamsulosin, for benign prostatic hyperplasia. The patient lives in an upstairs apartment. The nurse is most concerned about which side effect of Flomax: hypotension, tachycardia, back pain, difficulty urinating. Hypotension can lead to dizziness and a risk for injury to the patient. Question 11. A man is receiving heparin subcutaneously. The patient has dementia and lives at home with a part-time caretaker. The nurse is most concerned about which side effect of heparin: back pain, fever and chills, risk for bleeding, dizziness. A confused patient is at risk for injuring themselves and at risk for hemorrhage should an injury occur. Question 12. A female patient is prescribed metformin for glucose control. The patient is on NPO status pending a diagnostic test. The nurse is most concerned about which side effect of metformin: diarrhea and vomiting, dizziness and drowsiness, metallic taste, hypoglycemia. The patient is at risk because she is on NPO status and continuing to take an antiglycemic drug. Question 13. The nurse is reviewing the lab results of a patient taking lithium for schizoaffective disorder. The lab results show that the blood lithium value is 1.7 mg/L. What would the nurse take as the priority action? Induce vomiting, hold the next dose of lithium, administer an antiemetic, give the next dose of lithium. Lithium's therapeutic range is 0.5-1.5 mg/L. Toxicity begins at 1.5 mg/L. Question 14. A patient asks the nurse why they must have a heparin injection. What is the nurse's best response? Heparin will dissolve clots that you have. Heparin will reduce the platelets that make your blood clot. Heparin will work better than warfarin. Heparin will prevent new clots from developing. Heparin is used to prevent the development of new clots, it does not dissolve existing ones. Question 15. The nurse is reviewing the lab results of a patient who has presented in the emergency room. The lab results show that the troponin T value is at 5.3 ng/ml. Which of these interventions, if not completed already, would take priority over the others? Put the patient in a 90-degree position. Check whether the patient is taking diuretics. Obtain and attach defibrillator leads. Check the patient's last ejection fraction. Normal troponin T levels are less than 0.2 ng/ml. This patient is undergoing an emergency cardiac event. Question 16. A nurse is caring for a patient undergoing a stress test on a treadmill. The patient turns to talk to the nurse. Which of these statements would require the most immediate intervention? I'm feeling extremely thirsty. I can feel my heart racing. My shoulder and arm is hurting. My blood pressure reading is 158/80. Unilateral arm and shoulder pain is a classic symptom of myocardial ischemia. The stress test should be halted. Question 17. The nurse is reviewing the lab results of a patient who has presented in the emergency room. The lab results show that the BNP value is 615 pg/milliliter. What would the nurse take as the priority action? Call a cardiac code and implement emergency measures. Check the patient's oxygen saturation. Inform the physician the patient has congestive heart failure. Encourage the patient to limit activity. An elevated BNP indicates decreased cardiac output. A priority intervention is to ensure proper oxygenation. Question 18. A nurse is caring for a patient after a coronary angiogram. Which of these actions taken by the nursing assistant would most require the nurse's immediate intervention? The nursing assistant fills the pitcher with ice water. The nursing assistant elevates the head of the bed to 60 degrees. The assistant refills the ice pack on the insertion site. The assistant places an extra pillow under the head. After a coronary angiogram, the patient should have their bed no higher than 30 degrees to prevent bleeding at the site. Question 19. A man has been taking lisinopril for CHF. The patient is seen in the emergency room for persistent diarrhea. The nurse is concerned about which side effect of lisinopril: vertigo, hypotension, palpitations, nagging, dry cough. The patient is particularly at risk for hypotension due to possible dehydration from fluid loss. Question 20. The nurse is taking the health history of a patient being treated for sickle cell disease. After being told the patient has severe generalized pain, the nurse expects to note which assessment finding: severe and persistent diarrhea, intense pain in the toe, yellow-tinged sclera, headache. Jaundice, yellow-tinged sclera, is a common finding of sickle cell disease due to bilirubin released from destroyed RBCs. Question 21. A client with multiple sclerosis reports a constant, burning, tingling pain in the shoulders. The nurse anticipates that the physician will order which medication for this type of pain: alprazolam, Xanax, corticosteroid injection, gabapentin, Neurontin, hydrocodone/acetaminophen, Norco. Anticonvulsants like gabapentin are often the first line of treatment for nerve pain. Question 22. Which of these clients is likely to receive sublingual morphine? A 75-year-old woman in a hospice program, a 40-year-old man who just had throat surgery, a 20-year-old woman with trigeminal neuralgia, a 60-year-old man who has a painful incision. Sublingual morphine is often used in hospice for patients unable to swallow or where access is difficult. Question 23. In educating clients on ways to manage pain, which topic can be appropriately delegated to a LPN/LVN who will continue under supervision? Acupuncture, guided imagery, alternating rest/activity, over-the-counter medications. Alternating rest and activity is a standard treatment within the nursing scope of practice for all nurses. Question 24. The nurse assesses a patient suspected of having an asthma attack. Which of the following is a common clinical manifestation of this condition? Audible crackles and orthopnea, and audible wheeze and use of accessory muscles. Audible crackles and use of accessory muscles, audible wheeze and orthopnea. Wheezing and the use of accessory muscles are classic signs of an acute asthma attack. Question 25. The nurse assesses a patient suspected of having meningitis. Which of the following is a common clinical manifestation of this condition? A high WBC count and decreased level of consciousness, a high WBC count and manic activity, a low WBC count and manic activity, a low WBC count and decreased level of consciousness. Meningitis usually presents with increased WBC due to infection and decreased consciousness due to increased ICP. Question 26. A patient is being treated in the neurology unit for meningitis. Which of these is a priority assessment for the nurse to make? Assess the patient for nuchal rigidity. Determine past exposure to infectious organisms. Check the patient's WBC lab values. Monitor for increased lethargy and drowsiness. Lethargy and drowsiness indicate a decreased level of consciousness, the cardinal sign of life-threatening increased ICP. Question 27. The nurse is caring for clients in the pediatric unit. A 6-year patient is admitted who has second and third degree burns on his arms. The nurse should assign the new patient to which of the following roommates? A 4-year-old with sickle cell disease, a 12-year-old with chickenpox, a 6-year-old undergoing chemotherapy, a 7-year-old with a high temperature. Burn patients are vulnerable to infection. Sickle cell disease is not communicable, making this a safe roommate choice. Question 28. A patient with meningitis is being treated with vancomycin 4. The nurse notes that the urine output during the last 8 hours was 200 ml. What is the nurse's priority action? Check the patient's last bun. Ask the patient to increase fluid intake. Ask the physician to order a diuretic. Notify the physician of this finding. Vancomycin is nephrotoxic. A decrease in urine output is a serious adverse effect that must be reported. Question 29. A patient is being admitted to the ICU with a severe case of encephalitis. Which of these drugs would the nurse not expect to be prescribed for this condition? Acyclovir, Zovirax, mannitol, osmitrol, lactate ringers, phenytoin, dilantin. Lactate ringers is for fluid replacement, which is not warranted if a patient is at risk for high ICP. Question 30. The nurse is treating a patient who has Parkinson's disease. Which of these practices would not be included in the care plan? Decrease the calorie content of daily meals to avoid weight gain. Allow the patient extra time to respond to questions. Use thickened liquids and a soft diet. Encourage the patient to hold the spoon when eating. Calorie content should be increased because of dysphagia and extra calories burned due to muscle rigidity. Question 31. A 45-year-old woman is prescribed ropinirole, Requip, for Parkinson's disease. The nurse is most concerned about which side effect of ropinirole: slurred speech, sudden dizziness, mask-like facial expression, stooped posture. Dizziness and orthostatic hypotension are serious effects of this drug that increase fall risk. Question 32. The nurse is taking the health history of a patient being treated for Parkinson's disease. After being told the patient has classic symptoms, the nurse expects to note which finding: tremors, low urine output, exaggerated arm movements, risk for falls. Tremors are one of the 4 cardinal signs of PD: tremor, rigidity, bradykinesia, postural instability. Question 33. A nurse finds a patient unconscious with rhythmic jerking of all 4 extremities and foaming at the mouth. What is the nurse's priority action? Administer lorazepam, Ativan. Turn the patient to his/her side. Call the physician. Suction the patient. Turning the patient to the side maintains an open airway, which is the first priority during a seizure. Question 34. A nurse is giving discharge education to a patient diagnosed with epilepsy. Which of these teachings would she stress the most? Avoid doing alcohol and drugs. Follow up with the neurologist as prescribed. Do not stop taking anticonvulsants, even if seizures have stopped. Wear a medical alert bracelet. Stopping anti-epileptic drugs suddenly can cause rebound seizures and status epilepticus. Question 35. The nurse is caring for a patient in the ICU with a spinal cord injury. BP is 100/55 and pulse is 48, down from baseline. What should the nurse expect to be ordered next? Assess the patient for decreased consciousness. Administer normal saline. Insert in tube. Connect and read in EKG. The patient is entering neurogenic shock. Normal saline is used to treat the hypotension and bradycardia. Question 36. A nurse is caring for a patient who is suspected to have sustained a spinal cord injury. What best describes the overarching principles of care? Immobilize the cervical area. Monitor the patient's level of consciousness. Help the patient with activities of daily living. Facilitate tissue perfusion to the cord while maintaining airway and breathing. Maintaining ABCs, airway, breathing, circulation, is the essential guiding principle for acute spinal injury. Question 37. A patient is admitted after a multiple sclerosis exacerbation and ordered methylprednisolone, Solomedrol. What is the expected outcome? A decrease in muscle spasticity, a slowed progression of MS-related plaques, a decrease in the length of the exacerbation, a stabilization of mood and sleep. For methylprednisolone is the first line of treatment to decrease the length and severity of an MS relapse. Question 38. A nurse knows that which of these patients are at greatest risk for a stroke? 60-year-old male, 270 pounds, atrial fibrillation, history of TIA. 75-year-old male, migraines, drinks wine, Hispanic. 40-year-old female, high cholesterol, oral contraceptives. 65-year-old female, African American, sickle cell, smoker. This patient has the most high risk factors: obesity, atrial fibrillation, and a previous history of TIA. Question 39. A nurse treats a patient in the 72-hour period after a stroke. The nurse would be most concerned about which assessment finding. INR is 3 seconds long. Heart rate is 110 beats per minute. Intracranial pressure is 22 mm/Hg, blood pressure is 140/80. A target ICP should be less than 20 mm/Hg. The patient is at high risk for increased ICP due to edema post-stroke. Question 40. A patient asks why they developed cataracts and how they can prevent it. What is the nurse's best response? Age is the biggest factor. Unprotected exposure to UV lights. Age, injury, corticosteroids, and UV exposure are contributing factors. There is nothing you can do to prevent them. This answer covers common factors and includes preventable risks like UV protection and steroid management. Question 41. A nurse is educating a patient about bimetoprost, Lumigan, for glaucoma. Which statement indicates correct understanding? I should experience less blurriness in my central vision. This medication won't help my vision at all, but will keep it from getting worse. My peripheral vision should increase to its normal state. This medication will help my eye restore intraocular fluid. Glaucoma cannot be cured. Treatment focuses on preventing further vision loss. Question 42. A patient with glaucoma describes their eye drop routine. They instill the first drop and wait 1 minute before the second. What is the nurse's best response? You should wait 10 to 15 minutes between different medications. Your routine is very good. It is not the best practice to close your eyes. You should be pressing your finger in the other corner. Waiting 10 to 15 minutes ensures the first medication is absorbed and not washed out by the second. Question 43. Which patient is an appropriate candidate for a closed MRI without contrast? 20-year-old woman with joint pain and low BMI. 35-year-old woman with MS trying to conceive. 67-year-old man who had open heart surgery 4 years ago. 40-year-old woman in a hypomanic state. The other patients have contraindications like potential pregnancy, metal implants, or inability to stay still. Question 44. A nurse is feeding a patient taking bumetanide, Bumex, who has Parkinson's disease. Which of these foods is the priority? Foods containing the least amount of salt. Foods containing the most amount of potassium. Foods containing the most amount of calories. Foods containing the most amount of fiber. Bumex is a loop diuretic that can cause hypokalemia. Ensuring potassium intake is essential. Question 45. A nurse knows that which of these patients are at greatest risk for developing osteoporosis? An 80-year-old man who has a thin build. A 48-year-old African American female who smokes. A 55-year-old female with an estrogen deficiency. A 70-year-old Caucasian female who takes oral corticosteroids. This patient has the most risk factors: age, gender, ethnicity, and secondary risks like corticosteroids. Question 46. A patient asks why she should take vitamin D supplements for bone health. What is the nurse's best response? It's a standard part of nutritional treatment. It helps your intestines absorb calcium, which is important for bone formation. It stimulates skin cells to produce calcium. Vitamin D should not be taken by someone of your age. Vitamin D's primary role in bone health is helping the intestines absorb calcium. Question 47. A nurse is caring for a patient with a cast on the right leg. Which finding would most concern the nurse? Capillary refill time is 2 seconds. The patient complains of itching. The cast has a foul-smelling odor. The patient is on antibiotics. A foul-smelling odor is a major warning sign of infection or a pressure ulcer beneath the cast. Question 48. A nurse is administering alendronate, Fosamax, to a bedbound patient. What is the most important consideration? Sit the head of the bed up for 30 minutes after administration. Give the patient a small amount of water. Feed the patient 10 minutes after administration. Assess for back pain. Bisphosphonates cause esophageal irritation. Staying upright for 30 minutes reduces the risk of esophagitis. Question 49. How would a nurse best describe osteomyelitis to a patient? It is a gradual breakdown and weakening of your bones. It is caused by not having enough vitamin D. It is an infection in the bone. This question should be directed to your healthcare provider. Osteomyelitis is defined as an infection in the bone caused by bacteria from inside or outside the body. Question 50. An infection control nurse cares for a patient with an infectious heel ulcer. What is her priority intervention? Place the patient under contact precautions. Use strict aseptic technique when caring for the wound. Place another dressing to reinforce the first one. Elevate the patient's leg. A patient with an infectious wound that saturates dressings must be put under contact precautions to prevent spread. Question 51. A fractured elbow patient has an unequal radial pulse and a hand that is swollen and numb. What is the priority intervention? Place the patient in a supine position. Ask the patient to rate his pain. Wrap the fractured area with a snug dressing. Start in 4 in the other arm. These are signs of acute compartment syndrome, and 4 is the priority to prepare for emergency surgery. Question 52. A nurse is caring for a patient 24 hours after a hip fracture. Which assessment is essential for detecting fat embolism syndrome? Performing passive range of motion. Assess mental status for drowsiness. Assess the pedal pulse and capillary refill. Administer a stool softener. A decreased level of consciousness is the earliest sign of fat embolism syndrome. Question 53. What is the overarching nursing concern for patients with splints, casts, or traction? To assess for and prevent neurovascular complications. To ensure adequate nutrition. To provide education for maintenance. To treat acute pain. The priority for any orthopedic immobilization is monitoring for peripheral neurovascular dysfunction. Question 54. What nursing action demonstrates understanding of the priority diagnosis for a patient in traction? The nurse assesses pulse, color, pain, and feeling every hour. The nurse orders meals with protein and calcium. The nurse teaches the patient not to scratch under the cast. The nurse administers oral painkillers. Hourly neurovascular checks, the 6 Ps, address the priority risk of neurovascular dysfunction. Question 55. A patient complains of gastric pain, fever, and diarrhea. Which finding should be reported immediately? Abdominal distension. A bruit near the epigastric area. 3 episodes of vomiting in the last hour. Blood pressure of 160/90. A bruit in the aortic area suggests an aneurysm, which is a life-threatening medical emergency. Question 56. What nursing consideration is a priority immediately after an endoscopic procedure with general anesthesia? Raise the side rails of the patient's bed. Do not offer fluids, food, or any oral intake. Check the temperature of the patient. Teach the patient to avoid aspirin. The patient must remain NPO until their gag reflex returns to prevent aspiration post-anesthesia. Question 57. A nurse is preparing to palpate/percuss an abdomen. Which finding causes the nurse to immediately stop? The patient states it might hurt. There is a pulsating mass on the upper middle abdomen. The patient has black, tarry stools. The patient had an endoscopy 2 days prior. A pulsating mass indicates an aortic aneurysm. Palpation could lead to rupture and death. Question 58. Which patient is at highest risk for developing oral candidiasis? 77-year-old woman taking an antibiotic. 35-year-old man who has had HIV for 6 years. 40-year-old man undergoing chemotherapy. 80-year-old woman with dentures. While all have risks, the elderly taking long-term antibiotics are at the highest risk for oral thrush. Question 59. What intervention demonstrates understanding of the priority diagnosis for an oral cancer patient with high secretions? The nurse uses a pen pad to communicate. The nurse provides oral care every 2 hours. The nurse listens for bowel sounds. The nurse suctions as needed and elevates the head of the bed. Ineffective airway clearance is the priority. Suctioning and positioning are the corrective interventions. Question 60. A patient asks what mood stabilizer would not require regular lab testing. What is the nurse's best response? Valproic acid, Depakote, clozapine, Clozaril, lithium, risperidone, Risperdal. Risperidone is the only drug listed that does not require regular blood monitoring for therapeutic levels. Question 61. Which condition would not contraindicate the nasal, live, influenza vaccine route? The patient takes long-term corticosteroids. The patient is not feeling well today. The patient is 55 years old. The patient has young children. Young children in the home are not a contraindication unless they are severely immunocompromised. Question 62. Which condition would contraindicate the use of a CPAP machine? The patient is in the late stage of dementia. The patient has a history of bronchitis. The patient has had suicidal attempts. The patient is on beta blockers. Dementia is a contraindication as the patient must be able to follow commands and use the device independently. Question 63. Which assessment finding demonstrates a successful outcome of a catheter ablation? The patient is free of electrolyte imbalances. The patient's WBC count is within normal limits. The patient's EKG reading is regular. The patient's urine output is 45 ml/hour. Catheter ablation is used to treat arrhythmias. A regular EKG indicates the procedure worked. Question 64. A patient has a creatinine of 2.5 mg/dl, WBC 11,000, and hemoglobin 12. Which order should the nurse question? Administer 30 units of Lantus daily. CT of the spine with contrast. X-ray of the abdomen. Administer heparin subcutaneous. A high creatinine indicates renal impairment. Contrast dye is nephrotoxic and contraindicated. Question 65. A physician is considering TPA for a stroke. Which history question is not important for the nurse to ask? What time did symptoms appear? Are you taking blood thinners? Have you had head trauma in the past 3 months? Have you had any blood transfusions within the year? Blood transfusions are not a contraindication for TPA, whereas timing and anticoagulant use are critical. Question 66. A patient with gastritis is being discharged. Which statement indicates that additional teaching is required? I avoid NSAIDs. I only take a daily aspirin. I always avoid eating hot and spicy foods. I will continue taking my antacids after meals. I will only drink coffee once a week. Aspirin is an NSAID and can irritate the stomach. It should be avoided by patients with gastritis. Question 67. A patient has been taking naproxen for back pain. Which statement indicates the nurse needs to contact the physician? I get an upset stomach without meals. My back pain right now is about a 3/10. I get occasional headaches. I have ringing in my ears. Ringing in the ears, tinnitus, is a sign of naproxen toxicity and must be reported immediately. Question 68. A patient has been taking Ramipril for 4 weeks. Which statement is most important to pass to the physician? I get dizzy when I get out of bed. I'm urinating much more than I used to. I've been running on the treadmill. I can't get rid of this cough. A dry, persistent cough is a classic adverse effect of ACE inhibitors and may require a medication change. Question 69. A patient stopped taking Xanax 24 hours ago and has tremors and pacing. Which intervention takes priority? Have the patient lie down on a stretcher with bed rails up. Give the patient a cup of water. Assure the patient that he will be okay. Alert the physician that the patient needs Xanax. Xanax withdrawal can cause seizures. Placing the patient on a stretcher with rails up is a priority precaution. Question 70. Which precaution is most important to prevent transmission of hepatitis A from a child? Encourage vaccines for family members. Use needleless systems. Teach the child and enforce strict hand washing. Teach the family the dangers of contaminated water. Hand washing is the most effective way to prevent the fecal-oral transmission of hepatitis A. Question 71. The nurse notes a patient's eyes are yellow-tinged. Which result would further assist in confirming a hepatitis diagnosis? Decreased serum bilirubin, elevated serum ALT levels, low RBC and hemoglobin, increased blood urea nitrogen level. ALT is a liver enzyme. Elevated levels indicate liver damage, which is common in hepatitis. Question 72. Which patient has the greatest risk of contracting hepatitis B? A sexually active man with type 1 diabetes, a 75-year-old woman in a nursing home, a child in a country with poor sanitation, a sexually active 23-year-old man who works in a hospital. Healthcare workers and sexually active individuals have the highest risk of blood/body fluid exposure. Question 73. A patient is to receive 2000 ml of LR over 36 hours. The drop factor is 15. What is the drops per minute? 8, 10, 14, 18. Formula: volume x drop factor, / time in minutes. 2000 x 15 / 2160 equals 13.88, rounded to 14. Question 74. A patient is to receive 100 ml of antibiotic over 30 minutes. The drop factor is 10. What is the drops per minute? 11, 19, 26, 33. Formula: volume x drop factor, / time in minutes. 100 x 10 / 30 equals 33.33, rounded to 33. Question 75. Which statement would the nurse identify as reflecting schizoaffective disorder? I just want to stab myself. What's the point in life anyways? My thoughts are racing because of the conspiracies against me. I hear voices every day. Schizoaffective disorder presents with both mania, racing thoughts, and delusions, paranoia/conspiracies.